co-chair, Madam Elena, distinguished guests and delegates, my friends. Now, whole day we have been listening to the diagnosis, screening programs in breast cancer. Now we are very much tired. Now I am a clinician, I am a surgeon who operates on breast cancer patients. Now our main objective of all doctors or concerned persons is to prevent a disease or prevent the sequences of a curable disease or prevent, delay or ameliorate the sequences of an incurable disease like breast cancer. In other words, from a philosophy point, understanding breast cancer management is a specialization to every phase of clinical practice and has got direct link with basic science like pathology and other departments. Now we have been listening to diagnostic modalities of different proteins and screening tests, which are very, very high level, 40,000 feet above the ground level, which is beyond my capacity to understand and comprehend. I am a surgeon, I work in the ground level. The flight first is in the ground, then takes off. Now what we have been listening, take-off flight on the higher level, 40,000 feet. But I will be concluding this session, I will be last speaker for us, I will speak while the flight is on the ground. That is triple ABC technique in clinical assessment in breast cancer diagnosis. Now clinical assessment is the most important tool in diagnosis, as has been very well highlighted by Professor Bell from USA, Professor Faris from Kingdom of Saudi Arabia, and Madam Jakia from Australia. Now they have been hinting that early detection is possible by only screening, and screening involves patient self-examination, that is by education, information and communication with the patient group, and also by clinical breast examination, and mammography or others will follow. Now my aspect was when I applied clinical breast examination, I am in a teaching academic hospital, I examine students and I teach students, undergraduates and postgraduate. I found that they read a lot of things, but when you ask them what are you going to do in clinical breast examination, they will completely not answer. They will go 50%, 60%, 70%. I thought, why? Because there is no standardized methods for clinical breast examination. All textbooks are filled with pages, what to do, what not to do. So I thought, why not devise a standard method which will be very, very informative and communicative to the concerned doctors. And this knowledge and this technique, this clinical breast exam technique, can be taught to paramedics, to nurses, to other individual healthcare workers as well through this technique. And that can be applied very well. So particularly in Saudi Arabia, this can be taught, as Professor Paris told. And groups of non-medicos can be informed, can be educated about this clinical breast examination. Because self-breast examination, the patient may miss, but clinical breast examination is very, very important by the person who is doing. So what is that standard method? I'll be telling. So very simple and very informative and very educative. Now this is the institute where I work. Surendra Sai Institute is near Calcutta. It's a postgraduate institute with 1,000 bedded hospital. We get a lot of breast cancer patients, both in early stage and locally advanced stage and metastatic stage. Now, I'll come to my topic. This triple assessment is the standard assessment. We know triple assessment, not clinical assessment. This is the Includes clinical, radiological, and pathological, step by step. Now, many doctors know after clinical they go to pathological. No. After clinical, you should go for radiological, because if you are hitting with a core needle biopsy, or you are hitting with a fine needle also, or you are doing a local excisional biopsy, then later radiology will be affected. That's why the sequence is clinical, then radiological, and finally the pathological. Radiological and pathological are high-level things that we are discussing today, 40,000 level things. But I am speaking about the clinical. And what is this standard practice that I will summarize? Now this, because clinical remains the cornerstone of diagnosis around the world. Access to radiological and pathological examination is available to 25% of the population. In developed countries, it may be available to 100% of the population. But in developing world, radiology and pathology is accessible only to 25 to 40% population, unless they are referred to tertiary care hospitals, like where I am working. So clinical examination remains the very, very important part for the clinician, maybe at ground level, maybe at the MBBS level or postgraduate level, or a paramedics. This remains very, very important. It is cost effective. If you are going for mammogram, there is money. If you are going for needle biopsy, there is money cost. But clinical examination, you need only primary tools. You don't need secondary tools. Secondary tools of microscope, of mammogram machine, and all those things. Now, what is that? This can be applied anywhere, anytime. So this is also important. And unfortunately, as I told you, Swartz textbook of surgery, Saviston surgery, and Bailey and Love surgery, there is no standardization. They have filled up pages. You have to examine this. We mug up before the examination. And when I ask during MBBS examination, postgraduate examination, I get 75% answer, not full answer. So then I divided this triple ABC method I devised. And this has been published in Clinical Method book, published by SRB in volume 2, second edition. It has come. So those of you in the countries where you are getting SRB, Sriram Bhatt's Clinical Method book, in Asian countries available, I don't know about Europe and America, this has come out already in the textbook. I mean the Clinical Method book, triple ABC method. Now I'll say what is the triple ABC. Now an innovative, these 3 sets of ABC are used in clinical application. The first ABC stands for axilla. Second, the doctor has to examine A, B, C. And he has to examine 3 ABC, 3A, 3B, C. What are these? First is the non-affected axilla. If the patient is having problem in the right side breast, first examine the for comparison. Always surgery compares with the other side. So comparison's sake, please examine the first non-affected axilla first, non-affected breast first, non-affected cervical area first, then come to the affected side. Affected side also includes same ABC. Now second ABC, so axilla. Axilla, you will examine the 5 set of nodes. Anterior or pectoral group, central group, posterior group, lateral group, and apical group. 5 sets of nodes in the axilla that all of you know. Now in the breast, you examine, this is obvious, but when there is early lesion, you have to examine the upper outer, upper inner, lower outer, and the central. That also 5. Axillary 5 set, and the breast 5 set. And in the cervical area, concerned doctor has to examine the 5 set of nodes, particularly level 5 node. Level 5 is posterior cervical. You have to examine the level 1, level 2, level 3, level 4. So 5. So that includes axilla for 5 set, breast for 5 regions, and cervical area for 5 level of nodes. And then third point comes the third ABC. This I told you, anterior group nodes, posterior group, central group, apical group, and lateral group. So total 5. You have to remember axilla 5 points. He has to remember breast 5 points, the central, upper medial, upper lateral, lower medial, lower lateral. He has to remember the cervical area 5 points, level 1, level 2, level 3, level 4, level 5. And particularly in breast, level 5 and level 4, this is the supraclavicular. Then third ABC stands for abdomen, bones and chest cavity. So abdomen 5 points. He has to remember the word lump, L-U-M-P. That mnemonic, lumps, will give him the 5 points of abdomen. Just putting a hand in the abdomen doesn't end the examination. Clinical examination means liver. He has to examine the liver. He has to examine whether it is enlarged, nodular, tender or non-tender. He has to examine the umbilicus for any deposits. He has to examine for moving dullness, for fluid, and he has to palpate for tumors, the Krukenberg tumors, and of course digital examination. He has to moving dullness. These are the 5 points in the abdomen. He has to make a digital rectal examination to find deposits in the or ovarian. And here to bone 5 points also he has to examine. What are the bone? He has to examine the vertebra, cannot exclude, ribs and sternum, proximal femur, proximal humerus, skull and brain. Then chest, C, this C, third C, chest 5 points. He has to examine for collapse, consolidation, intercostal fullness, particularly anteriorly for intercostal nodes. He has to examine the ribs in distal and for pleural effusion. These 5 points he has to remember. So this third ABC is for global examination. Second ABC is the local examination, and first ABC is the regional examination. So local, regional and global, that includes. So for easy recall, each ABC are given 5 points as I told you, and can be remembered as A to the power 5, B to the power 5, C to the power 5, and can be transmitted to persons, health workers, nurses, undergraduates, postgraduates, peripheral primary health centers, so that they can examine. Can be learned by beginners, experts, paramedics, center where radiological pathological assessment is not available and cost effective. Practicing this method in peripheral institutions will help in early detection and early referral to advanced centers for reducing mortality and morbidity. So I hope I have conducted. Education is a learning process or an experience in life by which knowledge is acquired, attitudes are developed to result in intelligent and skillful behavior. Now, if we are intelligent, we are skillful, we can transmit this concept to our, not only to our juniors who are in the process of education, but to all paramedics and all nurses, all concerned persons for breast cancer, diagnosis, prevention and treatment. I hope with that I will conclude and thank you for your nice and kind attention. Thank you, chairpersons. These are the references. This is the dam, the biggest dam in Asia, and the medical college is under this dam. This is the reservoir. Thank you, sir.
Thank you very much. Thank you.
Thank you.